Hi friends, today we will see about how to identify normal and abnormal menstruation. The normal menstruation has four characteristics. The first one is frequency, second one duration, third the amount of flow, and fourth one the pattern. Let us take the first characteristics, that is the frequency. How often does menstruation occur? Generally, it is around 28 days. It usually correlates with the lunar cycle. But just like how the height, weight differs for each individual, the menstrual cycle also can differ. It can be any time between 21 days to 42 days. What does it mean? If somebody gets once in 28 days, it is normal. Somebody gets every 25 days, that is also normal. If someone gets every 35 days or 40 days, that is also normal. It has to be the same every month. Okay. It can be plus or minus 5 to 7 days. Next characteristics, that is called duration of the flow. Generally, we all know that the normal menstruation lasts for about 3 to 5 days. If it is even 2.5 days, that is okay. If it goes up to 7 days also, it is okay. Every month it should be the same. Some month it should not be 2 days and some months it should not be 7 days or 8 days. So the pattern should be the same every cycle. And then the amount of flow. How do you calculate the flow? You don't know how much the other person is bleeding and you can't measure. How do we measure? It is a perception by you. How many pads do you change during your menstruation? The general pattern is first day it will be say 2, second and third day it can be up to 3, then fourth, fifth day again it is 2 or 1. If you had been having this sort of a pattern for say till 35 years and suddenly it becomes, you feel you are changing too many pads per day, then it is abnormal. Okay. So there should not be any sudden change in the pattern. If the bleeding is less, actually, it is not very troublesome. But if the bleeding is heavy, it is troublesome. Why? Many of you think that the blood that is lost in the menses is bad blood and it is okay to lose it. No, whatever you lose in the menstruation is the same blood that goes to your brain, heart, etc. So when you bleed heavily, you lose more blood than you can compensate by taking iron containing food and tablets. So in the blood loss is more, you tend to become weak. The hemoglobin keeps decreasing. So whenever there is an unusually heavy flow, you have to consult your doctor. The flow actually nowadays can be measured by what is called as menstrual cup. I will put a separate video about this menstrual cup. The fourth characteristics that I told you is a pattern. Like each person develops a pattern. The first day it starts, second day flow heavy, third day it reduces, fourth, fifth day it stops. Some women always tend to have up to 7 days. But if the same pattern is followed from your menarche, that is your puberty time, till your menopause, that is fine. It is normal menstruation. So as I said earlier, you had been getting irregular periods once in 28 days. Suddenly you have started getting once in 45 days or 60 days. It is abnormal. So whenever the frequency is less or more, the duration is more, or the flow is more, then you have to consult a doctor. For the menstruation to occur normally, your pituitary has to secrete its hormone normally, your thyroid has to function normally, your weight has to be normal, your dietary habits have to be optimal or a good balanced diet, your activity, physical activity should be again optimal, your ovaries should be normal, your uterus should be normal. Whenever the menstruation is abnormal, always consult your doctor and make sure that your health is okay. Thank you.